Hello and welcome to Medicine Simplified. Today I would like to explore everything important about serum calcium with you. We will start with the basics and as we progress, tackle more complex facts about this fantastic mineral essential for life. Calcium is element number 20 on the periodic table. It is an alkaline metal and in its atomic form is two electron shorts of a stable state, making it very reactive. In the chemistry of life, calcium plays an essential role, not only in the formation of bones and teeth, but also in normal blood coagulation, muscle contraction, cellular signaling, immune system function, maintenance of the normal pH level of body fluids, and the process of cellular death. Additionally, it acts as a cofactor for many important enzymes. Calcium is the most abundant mineral in the human body, making up about 1 to 2% of body mass. Approximately 99% of calcium is stored in bones, while the remaining 1% is responsible for all the functions mentioned earlier. Normally, calcium metabolism is regulated by complex interaction between parathyroid hormone, vitamin D, and calcitonin. While calcitonin lowers calcium levels, it plays a minor role in calcium metabolism in humans. The major roles are played by parathyroid hormone and vitamin D. Parathyroid hormone is produced by four parathyroid glands located adjacent to the thyroid gland. Para is derived from Greek and means beside. This hormone is released in response to low calcium level. It causes the release of calcium from bone, increases the resorption of calcium in the kidneys, and activates vitamin D in the kidneys. Vitamin D increases calcium absorption in the intestines and enhances calcium absorptions in the kidneys. It is important to remember that the body prioritizes calcium in the blood over calcium stored in bones. Therefore, if calcium intake is inadequate for any reason, the body will draw calcium from bones, which, if it continues for a long time, may lead to osteoporosis. Calcium is transported by blood, specifically serum, which is the part of blood that does not contain red blood cells. In serum, about half of total calcium is free in its atomic form, and this portion is biologically active. The other half is bound to albumin, a serum protein that performs many important functions. Given this information, when we want to examine calcium levels in the blood, we'll look for two measurements: total calcium and free or ionized calcium. These are normal level of serum calcium. The normal ionized calcium level is about half of the total calcium level. It is important to request both total and ionized calcium tests together with serum albumin, as I will explain later. Serum calcium level may be normal, lower than normal, or higher than normal. Low calcium level are referred as hypocalcemia. Hypo is derived from Greek and means below. It is important to note that hypocalcemia is often not true hypocalcemia. In many cases, low total serum calcium is a result of low albumin levels, while ionized calcium, the biologically active form, remains normal. Low albumin level or hypoalbuminemia can be caused by various conditions such as kidney disease, liver disease, and malnutrition, particularly in the elderly. This is why it is necessary to measure both total and ionized calcium together with serum albumin. These individuals will not benefit from calcium supplementation as the underlying issue is low albumin level, which should be addressed by treating the primary cause or by supplementation of albumin. The most important cause of true hypocalcemia is iatrogenic hypoparathyroidism, which is a rare condition that occurs when all four parathyroid glands are accidentally removed during thyroid surgery. After some time, usually when ionized calcium drops below 50% of its normal value, tetany or involuntary muscle spasm can occur. Calcium stabilizes cellular membranes, so low serum calcium level can lead to excessive excitability in neurons and muscle cells, resulting in tetany. Another significant cause of hypocalcemia is chronic kidney disease. The kidneys are responsible for activating vitamin D, so when kidney function declines below a certain point, levels of activated vitamin D decrease. There are other less significant causes of low serum calcium level which should also be considered. In cases of refractory hypocalcemia, low calcium level that do not respond well to supplementation with calcium, one should always consider hypomagnesemia, as low calcium level may only normalize after correcting low magnesium level. High serum calcium is known as hypercalcemia, with hyper being also derived from Greek meaning above. The two primary causes of high serum calcium include excessive production of parathyroid hormone, also known as hyperparathyroidism, and malignant diseases. When we identify hypercalcemia, we should first attempt to rule out hyperparathyroidism, which is simple to do by measuring parathyroid hormone levels. If elevated, we look for functional parathyroid tumors. If parathyroid hormone levels are low, we should be concerned and explore the possibility of tumors, especially multiple myeloma and bone metastases from other tumors. Also, some tumors, such lung and breast cancer, secrete proteins similar to parathyroid hormone, which leads to hypercalcemia. Hypercalcemia slows the brain, dries the kidneys, and wears down the bones. High calcium level causes excessive urination, which may lead to dehydration, which worsens hypercalcemia. It also promotes formation of kidney stones. As we previously mentioned, calcium is important for cellular signaling. And where do we have a lot of signaling? In the brain, of course. Normally, calcium level inside neurons or brain cell is low. And when we have elevated calcium level in serum, it starts to seep inside neurons, causing them to malfunction, which slows down thinking, causes lethargy, and in severe cases, coma. In most cases, excess calcium comes from bones. This, if lost, causes bone demineralization and osteoporosis. We can treat hypercalcemia with hydration, diuretics, corticosteroids, and by addressing underlying issue. In conclusion, I would like to highlight a few potential use cases for calcium beyond its role in correcting low serum calcium level. Calcium helps stabilize cell membranes, including those of heart muscle cell, which is particularly beneficial for individuals with elevated serum potassium, as they are at risk for severe arrhythmias. Additionally, calcium can be used to treat high serum magnesium level, a condition also known as hypermagnesemia. If you like this video, you can check another one on related topic of osteoporosis. Thank you for watching this video and have a great day.